A 59-year-old male patient presented to us with complaint of recurrent fever spike and a rash within the 30 days after blood transfusion. And on examination, the patient was still having fever spike. There was a macular rash which then progressed into generalized erythroderma, and the patient was having one episode of loose stool as well. So we did a laboratory investigation in this patient. The patient was having pancytopenia and deranged liver function test. And based on these findings and the recent blood transfusion, we were suspecting transfusion-associated graft versus host disease. But in this scenario, we have to exclude other differential as well, which include drug eruption and certain viral causes. So we did skin biopsy in this patient, and the skin biopsy shows a diagnosis which is consistent with the transfusion associated graft versus host disease. So a TAGVHD is one of the fatal complications after blood transfusion which occur in both immunocompromised and immunocompetent individual, and it occur when the viable lymphocyte in the donor blood get proliferate and engraft in the recipient blood and attack the recipient tissue, which include liver, bone marrow, and gastrointestinal tract and skin, which result into these manifestation of pancytopenia, deranged liver function test, and loose stool and recurrent fever spike. And it occur when the recipient body is unable to mount an effective immunological response, which occur in immunocompromised individual, or if the body is unable to recognize these lymphocytes as foreign, which occur in a partial HLA matching and genetically homogeneous population. That's why it's more common in Japan. Prevention is those people who are at high risk should be given the transfusion which are gamma irradiated, because the lymphocyte in these donor blood get destroyed and the chance of transfusion associated graft versus host disease significantly become low.